Did you know that one of the most important mistakes in nursing practice and one of the leading causes of adverse patient events are medication errors? As a licensed practical nurse, your role is essential in preventing, identifying, and responding to these situations. And yes, this is the key concept for the NCLEX-PN and for your daily practice in the United States. First, let's understand what a medication error is. It's defined as any preventable event that may cause or lead to inappropriate medication use or patient harm, while the medication is under the control of a healthcare professional, patient, or consumer. This includes errors in prescribing, transcribing, dispensing, administering, and monitoring medications. Let's look at some real-life examples. Giving a medication to the wrong patient, administering an incorrect dose, using the wrong route of administration, giving a drug to a patient who is allergic to it, or simply failing to document the administration correctly. All of these might seem like small oversights, but in clinical practice, they can put a patient's life at risk and also your license practice. To prevent medication errors, the NCLEX-PN emphasizes the six rights of medication administration. Let's review them. First, right patient. Check the name and the ID number carefully. Second, right drug. Compare the level with the medical order at least 3 times. Third, right dose. Calculate accurately and verify with another nurse if it's a high or low dose. Fourth, right route. Is this oral, IV, intramuscular, subcutaneous, etc.? And fifth, right time. Follow the prescribed schedule and frequency. Or last, the sixth, right documentation. Record immediately after administration. Some institutions add a seventh right reason, meaning you confirm that the drug is appropriate for the patient's condition. As an LPN, one of your most important responsibilities is to detect inconsistencies before giving any medication. Always ask yourself, is the medical order complete and legible? Is the dose unusual or different from the standard? Does the patient have a history of allergies or adverse reactions? Is there therapeutic duplication, for example, two drugs with the same effect? Does the route of administration make sense for this patient? If something doesn't look right, stop. Never ever administer the medication until you confirm the order with the registered nurse or the physicians. If you realize that an error has happened or is about to happen, follow these steps. Assess the patient immediately, check vital signs, and watch for any adverse reactions. Notify the registered nurse, RN, and the physician. Document the event objective, what happened, what drug, dose, time, and the patient's response. And finally, complete an incident report according to your facility's policy. Remember, the purpose of reporting is not to punish, but to prevent future errors. Medication errors are often related to human and environmental factors. The most common ones include fatigue and long working hours, lack of focus or distractions, poor communication among team members, use of unsafe abbreviations. To avoid them, always double check before administering. Keep a distraction free environment when preparing medications. Ask and confirm if you have any doubt. And finally, use electronic systems and barcode scanning whenever it's available. The NCLEX-PN evaluates your ability to maintain patient safety through accurate medication administration. These are typical questions that are included. What to do when you receive an unclear or incorrect order? How to prioritize your actions after medication error? What is the most important step after an adverse event? Remember, the most important ethical and legal principle is do not harm. Finally, every time you double check an order, question a dose, or detect a potential error, you're protecting a life. And that's what makes you an excellent licensed practical nurse, a professional who practices with safety, ethics, and awareness. If these contents help you to understand how to recognize a medication error and apply safe practices, save this video, share it with another LPNs who wants to practice legally in the United States. And finally, follow us on our digital platforms for more practical, educational content for your professional growth.